All right, let's go ahead and get started. Good morning, everybody. My name is David Martinez. I'm a director at Vitalyst Health Foundation. I direct our grants program as well as our priority portfolio area that we call Civic Health. This is our monthly Vitalyst 101 session that we call Spark Partnership, a Vitalyst introduction, as a way to introduce folks that haven't met Vitalyst to share more about our priority areas and our grant programming so you can better determine alignment with us. And we provide insights on how you can engage with us. Joined with me here is my colleague, Michelle Goodthunder, who will be monitoring the chat room. So as you have questions during the session, feel free to use that Zoom room with the questions and she'll do her best to answer them. But we will have a live Q&A at the end of the session to address anything that she can't or just to reiterate any important aspects. And also you can unmute yourself to ask your questions. We try to be as accessible as possible. So if you need assistance in Espanol, we have an email, conversemos@vitalysthealth.org. We have closed captioning available as a function of Zoom, so you can just select those settings as you need. You should all be muted as you entered, but as I mentioned at the end, we'll have a live Q&A, so you can unmute yourself, raise your hand, and we'll be in dialogue on that front. Again, use the Zoom room for the questions you have, and we could address those. This recording, all the slides and materials will be sent to all the participants and registrants for this month's session, and you'll receive that in an email in a day or two after this session. Apologize also for the hoarseness of my voice. I have caught that nasty bug going around, but feeling okay, just haven't regained my voice yet. So I have my tea and some water as backup in case. But let's go ahead and get started. So Vitalyst Health Foundation is a health foundation based in Phoenix, but we have partnerships across the great state of Arizona. Our vision is that all individuals and communities in Arizona are healthy and resilient. And we're on a mission to do that by connecting, supporting, and informing efforts that improve the health of individuals and communities in Arizona. You'll see this trio come up often, connect, support, and inform. And that already begins to shed some light on how Vitalyst Health Foundation operates. We're a big convener. We love to connect folks. We are a grant maker, so we leverage support, and we work in a lot of policy and systems efforts, and that often is involving informing elected officials and decision makers. So that's our mission. While we are a health foundation, we see health as more than just health care, though obviously with the cuts coming to Medicaid and via access here in Arizona and kids care for child health insurance, health care is still a big issue for us. Access to care is really a big piece of our priority areas right now. But as you begin to explore, if you have alignment with your entity, your organization, your coalition, collaborative, or your project, we often refer to this wheel, as we affectionately call it, that reflects the elements of a healthy community. You might have also heard this reference as the social determinants of health or social indicators of health. So you could really see that we see health as comprehensive. Health is reflected in almost every aspect of our life, and we use this visual to help folks better determine alignment with our mission to improve health. Again, health being more than just disease-oriented, medical-oriented, healthcare-oriented, but all the spokes of this wheel, for instance, affordable quality housing, open space, parks and recreation, how our communities are designed to promote that physical activity and connect people, including with multimodal transportation options. A quality, affordable food is a big one as well. So you can see more alignment with your efforts by looking at the wheel. And as a follow-up material to this, we'll send you a link to our website that shows a deeper dive into the wheel, because you might not see your specific efforts reflected in one of the spokes. But if you go to the website, you can click on each one of these spokes and it better defines what are those specific efforts that are often included, say, in social cultural cohesion or social justice. Those are pretty broad terms, right? So you can better determine, and then that material also has specific health outcomes to better define your alignment to improve health. So already you can begin to think, am I mission aligned with Vitalyst? If you see yourself in this wheel, you're mission aligned, and we have a pretty broad mission and look at the broader social determinants of health. So you can always, we partner with a lot of different kinds of groups. Of course, we hold an health equity and resiliency lens in all of our work that's reflected here. The intersectionality in each of the sections, that's really reflected for us by ensuring that those closest to the problem are closest to the solution. So as you're beginning your projects or forming your collaborative to do your important work, we really encourage engaging those community members with lived experiences in your efforts. Also, we really highly encourage folks to use as disaggregated data as possible so that your efforts are focused on those communities and populations with the greatest disparities in health here in Arizona. So, for instance, if your effort is focused on lowering the diabetes rates in Arizona, that's in the aggregate, right? We would highly encourage you to look at data to see which populations or communities face the greatest diabetes rates in Arizona and align your efforts to tackle that. That's one way, another way that we hold an equity lens. So as I said, we often do things in trios here. As I mentioned as well, Vitalyst does a lot of work around policy and systems change. You'll hear that more in depth in just a little bit as we take a deeper dive into our grant program specifically. But that's heavy work. It's an upstream mechanism that tackles the root causes of problems rather than, say, a downstream intervention that's more programmatic or direct service in nature. And because those efforts are so they take a lot of manpower, of people power, a long time. We really try to encourage work in collaborative networks or coalitions, really working to improve the conditions that impact health. So that's one goal of our work. Of course, we recognize those collaboratives are made up of individual partners, so we want each of those to be strong community partners, really well equipped to advance health equity. And as I mentioned, we do a lot of work around policy and systems change, a lot of advocacy and policy, public policy. So a goal area of ours is also to inform decision makers that prioritize community health and well-being. So these are three goals of Vitalyst that is really reflected in each of our programmatic priority areas. I like to say Vitalyst has three sides of our house. One side of our house is you see these programmatic priorities that I'll go in depth in just a little bit. The other side of the house is our responsive grant making program, which I'll get into in a few slides. And then the other side of our house is our fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ. If you're interested in learning more about what fiscal sponsorship is and how your effort might receive support as a fiscally sponsored entity, visit tapaz.org. That team is led by our colleagues Juan and Kelsey, who facilitate that month. They facilitate a monthly workshop very similar to this TAP-AZ 101 that you can register for. Fiscal sponsorship generally is just back office finance and accounting support, whether you have a C3 or not. If you do not, you can come under the 501c3 status of Vitalyst and TAP-AZ and receive the benefits of being a C3 nonprofit status, and also all of the back office finance and accounting support. Or if you do have a C3, you can explore different types of fiscal sponsorship. So you can receive grant-specific fiscal sponsorship or fiscal agency, where we assist with specific grants or essentially be your outsourced bookkeeper. But if you would like more information about TAP-AZ, again, visit tapaz.org and feel free to register for their monthly sessions as well. So you'll see the three sides of our house, these programmatic priority areas, our grant making, and TAP-AZ, our fiscal sponsorship program. The programmatic priorities are areas where each year Vitalyst staff meets and connects with community partners and decides on which areas, health areas, we are specifically going to focus on, and do activities connected with the three goals we have. Again, collaborative networks, strong community partners, and informing decision makers. So in this instance, we don't have responsive grant making. We have a director that oversees each of these priorities, and working with community partners really outlines their strategies and activities for the year that might include some non-competitive grants that the director facilitates with those community partners. But a lot of this is often non-monetary support by each of our directors leveraging their own background and experience in their areas, doing a lot of convening, participating in convenings, research, data, and advocacy, as I mentioned. So so our three programmatic priorities are civic health, healthcare integration, and housing. I oversee, in addition to our grant making program, our civic health portfolio that really is working to support long-term efforts that improve active community participation. Civic health is a way that we frame it because we want to make the connection that the more civic engagement and civic participation there is, the more connected you are in your communities, the healthier you are and the healthier your community is. And we think that boils up to create a healthier Arizona and a healthier country and a healthier democracy. So the work is done locally, but that big picture vision as well. Each of our priority areas, again, have activities around collaborative networks, strong community partners, and informed decision makers are three goals. So in the civic health bucket, for instance, the collaborative network that we support a few of them, but one a primary one is called One Arizona, a coalition of about 30 grassroots community-based organizations across the state that are working to build civic participation, especially as it relates to the census, redistricting, and voting access. Again, that systems approach to civic health. But we also work to strengthen community partners and collaborate with another organization called Instituto that does a lot of capacity building for a lot of civic health organizations in the field and in this movement. And we do a lot of informing decision makers by leveraging our own voice. We lobby at the state capitol on bills and issues that impact a person's ability to engage in our communities and government. So, for instance, right now there's a lot of bills that are trying to make it harder for Arizonans to vote easily, including eroding our vote by mail system, which 85% of Arizonans, no matter of your party, participate in. So we do a lot of advocacy work on that civic health front. And then you'll see my mug there. The person next to me is Anna Rossetti, our director who oversees our healthcare integration work. This is really to show the integration between the physical, mental, and social determinants of health. Again, the wheel and how all of the physical and mental health components integrate with that. This primarily is focused on our work in healthcare, because though health is more than just healthcare, having an insurance is important, and access to care is still an important aspect to be able to live a healthy life. So Anna works really closely again with the collaborative network called Cover Arizona Coalition that is really ramping up because of the pending cuts to Medicaid, helping Arizonans navigate the healthcare system, both the Affordable Care Act, the Medicaid expansion here in Arizona, but also the private marketplace. At the same time, she works to strengthen community partners, especially in healthcare issues that are top priority for Arizona, like healthcare workforce, child and maternal health, and other key public health measures like housing as medicine and food as medicine. Speaking of, and Anna also does a lot of our key lobbying at the state capitol to inform decision makers about all of the impacts of policy to healthcare as well. Now, speaking of housing, the guy next to Anna is Gabriel Jaramillo, our colleague who oversees our housing portfolio. His effort is broadly focused on healthy communities, including housing, but also includes multimodal transportation, community design, and other built environment kind of aspects of healthy communities. But our primary priority area is housing, which he has a lot of experience in. In this instance, the collaborative network, remember the goals, he works with is the Arizona Housing Coalition, which really brings together the spectrum of housing partners from houselessness to housing affordability and trying to find those solutions for Arizona's housing crisis. At the same time, he's working to strengthen community partners in that coalition and other entities that are really showing promising practices of especially workforce affordable housing. So he works really hard with school districts, community centers, health centers, community colleges, churches, um, to incorporate affordable housing into their plans and on their property so that they could address the workforce issues, especially, but the affordability issues with housing. And he does a lot of informing decision makers as well. There's a lot of bills at the Capitol that impact housing and affordability and funding that goes into those efforts as well. So he leads our advocacy efforts to inform decision makers around housing. The gentleman next to him is Sergio Perez, who is our Director of Strategic Communications. He works with to tell the story of Vitalyst and our grant partners and the impact that they're making throughout Arizona. But because of his background, he also facilitates conversations for us that's focused on food systems and education. So as you'll learn in just a little bit, we have a process called the discovery intake process that helps facilitate conversation. So as you reach out to Vitalyst to discover partnership, you'll be connected to one of the four directors at Vitalyst who, depending on what your project area is hoping to tackle. So, for instance, if you're working in the food system space, you would talk with Sergio and facilitate that conversation to discover partnerships. If you are doing something in housing, you would talk to Gabriel. If you're working in the healthcare space or the broad public health space, you would connect with Anna. And then in civic health and more general projects, you'll connect with me. So again, that's one side of our house, our programmatic priority areas. We do not have competitive responsive grant making for those. And you do not have to just be focused on those priority areas to be able to explore partnership with Vitalyst. Again, we have another side of our house, which is our responsive grant making program, which is what you see on this slide. This is where we have an open door policy to discover partnership with folks that fall and are aligned within these specific grant criterias. So in total, our responsive grant making program is really to support collaboratives working towards systems change. But depending on which grant you might align with depends on where you're at in your journey towards systems change. So in total, we have three grant types as part of our systems change grants program: the technical assistance grant, the Spark grant, and the systems change grant. As I mentioned, systems change is heavy work. It takes a collaborative and it takes a long time and a lot of resources. So we have built with community feedback this grants program to be a multi-year as general operating grant as possible to help those collaborative advance in their journey towards systems change. So in total, it's a 5-year grant potential of nearly $225,000 if you start at square one with the technical assistance grants and then move up. But as you'll discover in later slides, you don't have to start from square one if you're ready to jump to the Spark grant or systems change grant. And I'll talk a little bit more about that in just a little bit. So as I mentioned, we have an open door policy at Vitalyst. So any group that finds alignment with Vitalyst, our mission, the wheel, and our grant types, you can complete what we call the discovery intake form. That's located on the grants and partnership webpage of vitalysthealth.org. So we can explore partnership with just about anyone in Arizona, but we highly encourage folks to really see if there is actual alignment with our grant types because our grants are pretty specific, supporting collaboratives working towards systems change, not just an individual organization providing direct service or programmatic work. But we have created this discovery intake form to ensure that we are open and accessible and practicing our values here at Vitalyst and discovering partnership with folks. So as you're listening to this webinar and as we have conversations, if you are seeing alignment, go to vitalysthealth.org, complete that discovery intake form. We'll receive the form, do an initial review, and if we see, yeah, there is alignment, you'll then be prompted to schedule a time to chat with one of those directors to have a deeper conversation, a 30-minute virtual call initially to determine if there is alignment. And then as I'll review, there's some next steps depending on which grant type you might be interested in. So the first of our three grants is our technical assistance grant. You can consider this a collaborative capacity building grant. It is again meant for those entities that are at the beginning stages of their journey toward systems change. You'll also see on this slide and the two other slides, as I'm talking about the Spark and systems change, the same 5 criteria for all of our grant types. It's the same. You must be in a collaborative to improve a health outcome, you working in a systems change lens with the health equity frame, and have a budget that's consistent with the scope of work. So it's the same 5 criteria, but as you'll see, it really does depend on where you're at in your journey towards system change again. So for instance, for technical assistance grants, you're at the beginning of your journey towards systems change. So for this, you might not even have the collaborative formed. That's what the technical assistance grants can help you support. So for this criteria, it could simply be one entity that is applying for the technical assistance grant to then build up the coalition, their collaborative, to build up the capacity of the collaborative, to then be in a better position to plan and implement their systems change. The health outcome should be known, the general kind of impact that you want to make to improve health. Again, using the will, that visual, to show which elements of a healthy community you're working in. You have to be working a collaborative that is hoping to impact a system of some sort. So it can't just be a collaborative that's formed for collaborative sake. It really does have to be a collaborative that has a specific systems change project. But again, at this stage, you don't have to know the specific intervention or solutions towards systems change. You just have to know that of what the general system you want to be changed, and that you're beginning to think through the effort that you have as actual systems change, the upstream approach, and not a downstream approach. A health equity lens, as I mentioned, from the beginning, you should be including those closest to the problem, close to the solution, and not as in-depth with the disaggregated data to show the greatest health disparity of the health impact you're working towards, but beginning to frame your effort around that lens as well. And then for the technical assistance grant, your budget has to be consistent with the proposed scope of work. These grants are up to 1 year, up to $20,000. I mentioned up to 1 year and up to $20,000 because it really does depend on what the specific capacity building need is, what the specific technical assistance need is of your collaborative. So if it is to convene partners over several months, that's a longer time frame, right? And it might be a longer or a bigger grant request. But if you're simply tackling one key aspect that you need to address as part of your collaborative to build trust or to set a communication strategy or to build up the governance, that might be a shorter time frame, smaller scope of work, and a smaller grant request. So you could request up to $20,000, but it doesn't have to be $20,000. This is often helped guided by working with a strong local consultant that we can help connect you with. And this often includes their scope of work to help you identify and address that specific capacity building need. And that amount of the fund of the grant request could cover the compensation of that consultant, which often might not be all the way up to $20,000. It might be smaller, again, depending on the scope of work. So for the technical assistance grants, again, we have folks go through that discovery intake form to discover partnership. So in order to determine if you are aligned with the technical assistance grant, you have to complete a discovery intake form. It's a quick form for us to capture some initial information about your organization, your collaborative, the system you hope to change, the criteria aspects of it. And then once we receive that, we'll review it, and if aligned, we'll be prompted to schedule a time with the Vitalyst director, as I mentioned, and they'll have that initial conversation with you. There might be some back and forth to clarify what your project is, what any questions or clarifications they need for that. Um, and once discovery is determined based on that feedback, if it's determined that it is a good fit, they'll receive a draft proposal from you that is about a two-page document along with your budget that reflects how your effort hits on those five criteria pieces. Again, there might be some back and forth so that they best understand and find alignment with the grant criteria, maybe to strengthen your grant proposal. They won't write the grant for you, but provide you with feedback to help strengthen it. And then once it's at a point where they see strong alignment, they'll invite you to submit that to our application portal, where we then go through our internal review process. We do review these on an ongoing basis throughout the fiscal year because we don't have to get board approval for these because of the amount. It goes up to $20,000. So as soon as we receive your proposal after you're invited to submit it by one of the directors, we go through our internal review process, and we have time to review them internally and then reach consensus on whether to fund or not based on your alignment with the criteria. And we have those reviews on a rolling basis every week as we receive the applications. There is no deadline for this. Again, the only two biggest considerations is we run on a July 1 to June 30th fiscal year. So we explore partnership throughout the year, but we really try to align efforts with our fiscal years. And then our own budget capacity. We have a limited amount of funds as a technical assistance grants. So as we go further into our fiscal year, we might have less funds available, but don't fret. Don't feel like you have to complete a discovery form immediate. We have a good amount of capacity for our technical assistance grants still for this fiscal year. So once you have worked to build up the capacity of your collaborative, hopefully then you're in a better position after that time period to apply for our Spark grant, which can be considered a planning grant. So once your collaborative has built up your capacity, built up the infrastructure and the trust needed for your collaborative, then you move into a planning phase for your systems change. And that's the Spark grant. It's meant to provide you, your collaborative, with some time to um, to think through what are those specific interventions and solutions towards systems change that we want to implement, and plan the strategies behind those a bit more comprehensively. And then hopefully throughout that process, the specific actions towards systems change are sparked, and that's why we call it a Spark grant. Again, you'll see the same five grant criteria. Has to be a collaborative, working to improve a health outcome with a systems change lens, a health equity framework, and a budget that's consistent with the scope of work. But you'll see you're a little further advanced in your journey towards systems change. So in this instance, your collaborative should be formed and have great capacity to actually plan. So in this instance, there does actually have to be more than one partner applying. You have to already be in collaboration. You'll see here, we have at least 2+ partners. We always say it's quality over quantity. We really want you to have the right partners at the table that will help drive your systems change. That includes, again, holding that health equity lens, those closest to the problem as closest to the solution. So that collaborative should be a bit more formed up than what we saw during the technical assistance grants. Similarly, your health outcome should be a little bit more specific, again, focused and framed with the wheel, the elements of a healthy community. And then your systems change work, you again should know what system you're hoping to change. And again, you don't have to know the specific intervention or solution yet. That's what the planning process is for, the Spark grant process is for. But you should be digging a bit deeper into what is holding the problem and the challenge in place that is preventing your efforts to improve health and have a strong health outcome. Health equity lens, again, including those community members with lived experiences, getting a bit deeper dive into that disaggregated data to ensure you're working with those communities and populations with the greatest disparities of health. And then the budget, again, consistent with the scope of work. The Spark grant is a 1-year grant of $25,000. Very similar to the technical assistance grant, we review the Spark grant opportunities throughout the year through our discovery process. So we would encourage those that find alignment with the Spark grant to go to vitalysthealth.org, our partnering with Vitalyst webpage, where you can complete that discovery intake form. And once again, once we receive that form, we'll review it. And if alignment, you'll be prompted to schedule a time to chat with a director. They'll connect with you and determine next steps. And if there is alignment, again, receive a proposal from you to review and find alignment within the criteria. Once that draft is in a position where they feel it's strong enough, they will invite you to submit that application into our grant review portal, and that begins our internal review process. While we review these ongoing throughout the year through that discovery process, we do have to get board approval for the Spark grants. So we have our grant cycles tied to our board meeting dates. So we have a fall cycle and a spring cycle. The fall cycle obviously has passed, and the spring cycle is coming up here. So if you find alignment with the Spark grant, complete a discovery intake form, you'll receive it. And then the next opportunity you'll have to submit that application would be by May 7th. That's the deadline. But if you complete a discovery form and the director finds alignment with the Spark grant, they might invite you to submit your application before May 7th, but our review process doesn't start until then. So then we go through our board review process. And then we'll have the funds, if approved, dispersed before the end of our fiscal year, which again ends on June 30th. Finally is our systems change grant, the third tier of our grants program. So this is, again, for those collaboratives that have built up their capacity. They've planned what their specific interventions and solutions are towards systems change. Now they just need funds to implement that systems change. And that's what you can refer to as our systems change grant, as more of like an implementation grant, right? Your capacity has been built of your collaborative, you've done your planning, now you just need to implement your systems change grant. So again, here you'll see the same 5 grant criteria, but at this point, you should be far advanced in your journey towards systems change. So your systems change project should be really well designed. Your specific interventions and solutions are identified. You've done that planning already. So you just need to implement it. So what is the exact what are you implementing? What's your project? The collaborative also should be really far advanced. The right partners at the table to help you implement your systems change efforts. And this is a really key piece of it because the application for systems change grant really helps evaluate the strength of your collaborative. And then, of course, this effort should be working to improve a specific health outcome, again, connected to the elements of a healthy community will. And you should be getting really specific with the disaggregated data holding this health equity lens with the impact that you're hoping to make for those communities and populations with the greatest disparities in health. And then for this, the budget, again, much more comprehensive. The budget for the system change grant is a 3-year grant of $175,000 total. So not only will you submit a budget spreadsheet, we have a template for that as well. You have the opportunity to provide a narrative in the actual application of the budget so that we can see its consistency with the proposed scope of work. We highly encourage organizations who are interested in the systems change grant to complete the discovery intake form so that we can find alignment, see if there is alignment with your effort, especially around the criteria around systems change, because sometimes that's really harder to see if it's not an effort that's working on, say, a direct policy or practice change, which is a more explicit type and condition of systems change. But there are other conditions of systems change that we have supported in the past, including resource flow changes, power dynamic shifts, relationships and connections, and the most transformative condition of systems change that's most difficult to see is a mental model shift, changing hearts and minds. You don't have to work on all the conditions, but a true systems change is reflected by each of those six conditions happening, but we recognize your effort might be focused on one or two of the conditions. So that is a really important aspect to find alignment in. And having that discovery consultation call helps determine if there is alignment. So you don't have to waste your time drafting an application if there is not alignment, if your effort isn't systems change or there's no alignment with any of the other criteria. While we highly encourage you to complete the discovery intake form, the systems change grant is an open application process. So any entity can simply submit an application through our website. As you'll see at the bottom, we open up this annual grant cycle in the fall, so it's closed for this year, but we can still explore partnership and discover if the systems change grant is aligned. And then once we reopen the grant cycle, likely in August for a due date, maybe in late September or October, then we would just work with you to tee up your application for that time frame. But again, you don't have to go through discovery, but we highly, highly, highly encourage it. Again, if you do complete the discovery form, we'll review and you'll have the opportunity to connect with the director, and then they'll outline or they'll determine if there's alignment. This application is a 5-page application, again, reflecting on the 5 criteria points. And then we have a budget template that you submit as well. As part of the application, as a measurement of your collaborative strength, we also have your collaborative partners, your core partners of your collaborative, submit letters of commitment. So once the deadline passes, we go through our internal review, our team review, which includes members of our board of trustees. And then after we review the written applications, we invite semifinalists to then present their proposal to our grant review team. And it's kind of a 2-step process, both the written application and then the presentation, which semifinalists are invited to do. That is a 30-minute presentation that's held virtually over a 2-week period of time, where your collaborative partners have the opportunity to tell your story in a way that might complement your actual written application. We do this 2-step application process, both the written application and the presentation, as an equitable grant making practice. We work with a lot of grassroots community-based organizations that may not have a grant writer, a fundraiser, or development officer. So their written application might not be as strong, but it's strong enough to be advanced and invited to present. And that's where these grassroots community-based partners really shine, and because they sure can tell their story. So it provides a bit of equity in our application process if folks don't have a full-time grant writer, say. Once we go through the presentations, our team does a review of those, and then we advance the recommendation to our board for ultimate review, consideration, and approval. Again, it's an annual grant cycle with the cycle opening in the fall. So that reviews at a very high level Vitalyst Health Foundation. Again, our grant making side of the house focus on collaboratives working towards systems change, the technical assistance grant, the Spark grant, and the systems change grant. Then we have our programmatic priority areas where we have it's our non-competitive funding and leveraging Vitalyst resources in different ways through our directors around housing, healthcare, and civic health. And then the other side of the house being TAP AZ fiscal sponsorship. So now we'll open it up to the Q&A. Michelle, were there any questions in the chat room?
No questions in the chat room. So if anyone wants to come off mute to ask a question or pop that in the chat, if you don't want to come off mute, you're more than welcome to.
Wonderful. Thank you so much, Robert.
Buenos días.
Yes. Hello, Josefina.
Thank you for this opportunity of being here and hearing. I wanted to ask, meanwhile that we're getting prepared, is there any training, education, anything you can share concerning fundraising?
We don't provide capacity building support for fundraising specifically. The closest alignment would be the technical assistance grants meant for collaboratives working towards systems change. So if that is a capacity building area that you need for your collaborative to bolster your resources to implement, plan and implement your systems change, that is something we can explore through the technical assistance grants. But again, it's meant for the collaborative and not individual organizations. The closest thing we do have to support you in this front is Vitalyst provides membership scholarships to the nonprofit membership organization called AZ Impact for Good. A lot of folks may have known it as the Alliance of Arizona Nonprofits previously. So if you visit the AZ Impact for Good website, you can click on membership and apply for a scholarship. And if you're aligned with Vitalyst using the will, if you are BIPOC, if you're led by a person of color, if you're serving people of color in Arizona, if you have a budget of less than $1 million, you would qualify for those membership scholarships. And that scholarship provides you with a 1 year membership to AZ Impact for Good. And they have a whole host of resources that can address your capacity building needs for individual organizations, including fundraising. They have a lot of capacity building workshops, including for fundraising. As a member, you also have access to their grant portal and grant website, so you can access greater funds there. And also, another resource that we have is, and by registering for this, we will enroll you in our own newsletters. And every other week, we send out a newsletter with a bunch of grant opportunities to that you can search, and then as you see in the alignment, apply on your own for those grant opportunities. We also highly encourage folks to engage with the local First Arizona Economic Resource Center, who also has a grants newsletter. And in our newsletter, it's linked, so you don't have to go digging for it, but if you can find it on your own, or maybe we'll put the link in the website as well. They have, for qualifying entities, free grant writing resources. And again, that's through the local First Arizona Economic Resource Center.
Thank you.
Yes.
We have a good question in the chat. Are university scholars allowed to apply for these grants? As a postdoctoral researcher, can I apply for the technical assistant grant?
Yes, great question, Pooja. Universities and colleges, university scholars can certainly apply for any one of our grant types as you see alignment with wherever you're at in your journey towards systems change. Some big caveats with that is a big consideration when a university is the lead applicant is ensuring that community is well represented in that effort and in the collaborative. And it's not often easy to be done at an institution, right, like a university, but we really do heighten our review of the health equity lens and the collaborative lens if the lead applicant is the university. Also, another important aspect is we do not allow university indirect cost for our grants. So if the university is a lead applicant, usually, right, you go through your university, maybe Office of Sponsored Projects through your foundation, and there's usually that overhead indirect for universities, and it can be as much as 30, 40, 50%. We do not allow that for university applicants. However, we have in the past had our lead applicants be university or college institutions, and they work with either their foundation office or their Office of Sponsored Projects to submit the application and have removed that indirect cost.
Thank you so much.
Yeah, thank you, Pooja. All right, Rosemary. Incredible how the universe works. An organization I work with closely just spoke with me yesterday about truly collaborating as our work aligns and providing guidance to students and holistic approach. This comes at the right time. Thank you. Awesome. I'd love to hear it. Any other questions? Seeing none, even if you have some later, don't fret. Again, we have an open door policy. Feel free to reach out to us. And again, if you see alignment with Vitalyst and any of our grant types, just go to vitalysthealth.org, complete that discovery form. We'll review it, and then you'll be prompted to schedule a time to chat with our team. So if you have any other questions, don't hesitate to reach out. We'll send a follow-up email with the recording and all the materials linked in the chat room and as we discussed today. Thank you so much for all of your efforts and for spending some time with us.